Wonder whether addiction is one disease, or at least chemical dependency is one disease. And they often think that, well, I have a cocaine problem, or in our world, I have an opiate problem. I've been using heroin or fentanyl or oxycodone, but I never had a problem with alcohol or pot or other drugs. So they really don't kind of get the fact that chemical dependency or addiction is really one disease. And it's an important thing to really figure out in terms of long-term recovery, because we need to know, do I have to give up all drugs, or can I just give up one? In order to answer it, we really need to understand the basic biology or the cause of chemical dependency. And what we find is that chemical dependency is an alteration or an abnormality of the pleasure center, or what we call the nucleus accumbens, deep in the middle of the brain, which is the part of the brain that gives us our drive, our cravings for sex and food to keep our species alive. It's a very powerful part of the brain, and addiction is a problem with that part of the brain. There's certainly genetic components, so some people are born with a vulnerability to get an extra dopamine rush, or maybe they're a little depleted in dopamine, and so when they do take drugs that release dopamine in the pleasure center, that they get more of an effect. And over time, that dopamine effect causes changes to the rest of the brain in terms of the memory circuits and the ability to make good decisions and things like that. So all addictive drugs release dopamine in that pleasure center. So to that extent, really, we think that chemical dependency is one disease, and that what causes somebody to be a heavy cocaine user or someone else a heavy opiate user is mainly circumstances. You know, we see an awful lot of people whose drug of choice is opiates, but their parents were alcoholics because there really weren't people using and abusing opiates back in the 40s and 50s and even 60s. But now opiates are everywhere, and so that tends to be what people are exposed to. So they use that and then get addicted to that. So we really think if you've got one form of chemical dependency on opiates, heroin, fentanyl, oxycodone, anything, you really are also an alcoholic, even though maybe you never drank heavily yet. But it's the same disease, because what we find from experience is that if people give up one drug, but they keep using other drugs that release dopamine in the pleasure center, they end up getting in trouble with that. They can either get in trouble because that other drug use starts creeping up, and before you know it, they're drinking too heavily and having problems from the alcohol, or the alcohol use can release enough dopamine that their brain then says, hey, I really want the good stuff, I want the heroin, and so they end up relapsing. And we've heard of a number of people dying because of that very scenario. They have a couple of drinks and then they go use heroin that they haven't used for 6 months or a year, and they overdose. A lot of people don't want to give up pot because they think that, well, it's such a mild drug, and in actual fact, pot is probably safer than alcohol, but it still releases dopamine in the pleasure center, and so it keeps the whole disease looking to get reactivated. It keeps the brain thinking about getting high. It keeps the brain thinking about a dopamine rush. And at a physical level, it keeps the brain looking and wanting an even stronger dopamine rush. So we think chemical dependency is one disease. The best thing is to just give it all up and learn how to be happy without putting chemicals in your brain. Learn that life is absolutely fabulous if you just, go through it and accept the ups and downs, and don't try to change your mood with mood-altering drugs.